Hello, I'm going to do my final head to toe assessment. My patient in the room to show that there's no notes. Anywhere. Oh, I think I'm recording myself. No, I had it the right way. Okay, I thought I was recording myself. No notes, nowhere, anywhere. Okay, let's flip this around. Oh, wait. Did I just record the room? Yeah, I recorded. Okay, so the first thing I'm going to do is check the chart and see that I need to do a head to toe assessment. I'm going to come into the room and wash my hands, provide for privacy, and I'm going to check the patient's name and date of birth. Can you tell me your name and date of birth, sir?
Justin, 83.
Okay, so you're born in 83. How old are you?
34.
I'm glad you had to think about that. My name is Mel. I'm going to be your student nurse. I'm going to do a head to toe assessment on you. Can you tell me the date right now?
The 3rd December.
Do you know where you are?
The hospital.
And do you know who the president is?
Trump.
Okay, so he's A&O times 3. His speech is not garbled or anything, so he has clear speech. When he walked into the room, his gait it was steady. He didn't use any assistance devices such as a walker or a cane. His posture is erect. His facial expression is normal, flat affect, and he, yeah. Okay, and do you have any current health problems right now?
No.
Okay. Do you have any pain anywhere?
No.
Do you have any allergies to any medication?
No.
Okay. I'm going to have you sit up straight for me for a moment, and I'm just going to check the alignment of your spine, which, sit straight, okay, and it is straight down, midline, it's symmetric, okay. Go ahead and lay flat for me. Can you please not look so enthused? Okay, so I'm going to start with the head here. I'm going to take your head off. First thing I'm going to do is look at the head. It's normal. I can't say this word all the time. Synthetic. It's round. It's symmetrical. I'm going to go ahead and palpate your head. Do you any pain with that?
No.
I didn't feel any lumps or masses or any lesions. His hair is coarse with no signs of lice. It has normal thickness and even distribution, and the color is normal for his skin and hair. Do you have any trauma to your head at all?
No.
Okay. The next thing I'm going to do is go to the face. Where is my, right here. Okay. So the next thing I'm going to do is go to the face here. The first thing, do you have any facial, can you go ahead and raise both eyebrows? Okay, smile. So frown. You're stuck at frowning. Cranial nerve 5 is intact, which is, he didn't have any facial droop or anything going on there. So no sign of a stroke or Bell's palsy. The first thing I'm going to look at is his eyebrows here, which are symmetrical. Looks like normal hair distribution. He was able to raise both eyebrows symmetrically. I'm going to look at the eyelashes, and those both look symmetrical. Normal distribution, doesn't look like any blotches of hair or anything are missing, evenly dispersed. The next thing I'm going to look at is your eyes. I'm going to test first your reaction to light. So go ahead and look just straight ahead. Okay, now I'm going to do the other eye. So his pupils were reactive to light, and also the other side, they constricted, the opposite side constricted as well, reacting to the light. The next thing I'm going to do is look underneath your eyes here. Go ahead and keep your eyes open. I'm looking in the lower conjunctive eye here. I don't see any drainage, edema, or pus or anything. I'm going to go ahead and check the size of your pupil. If you can just go ahead and open up your eyes wide. According to my chart here, I'd say his pupils are a size 4. So I would say his pupils are Perla. I do have to check accommodation real quick. I'm going to have you look at an object far away, such as the TV there. And then I'm going to have you look at my finger. Now look at far away. Now look at my finger. Okay, his eyes accommodated. The other thing I would do to check cranial nerve 2 is I would have him do a Snell chart, which is where he reads lines to check his vision. Do you wear any contacts or any glasses?
No.
Okay, so I would have him stand 20 feet away and read line 8, which is 20/20 vision, which would mean at 20 feet he can read what a normal person reads 20 feet away. So his vision would be perfect at 20/20. So I checked cranial nerve 3, 4, and 6. I'm going to check 6 right now. I'm going to have you follow my finger, okay? Go ahead and look at my finger. Okay, so cranial nerve 6. So 3, 4, and 6 are all intact with the eyes there. The cornea, or the sclera, is white. And then his cornea is dark brown, which is normal pigmentation for his eye color. The next thing I would do is I'm going to do a sharp and dull on your face here. Can you tell me whether that's sharp or dull? Close your eyes.
Dull.
Okay, and then...
Sharp.
Okay, so that is cranial nerve 5. Okay, the next thing I'm going to do, can you sit up so the camera can see better what I'm doing here? I'm going to check the, no, sit up. There we go. I'm going to check the ears here. So the first thing I'm going to do is check to make sure with my pen light that the eyes are even with the ears here, the canthus, which the ears are. And then I'm going to push on the torgus. I'm going to push on the mastoid process, and I'm going to pull on the penna. Did any of that hurt?
No.
Okay. And then I'm going to inspect the inside of the ear. Okay, I do see a little bit of earwax and serum. Okay, go ahead and turn your head so I can check the other ear if I can. I'm going to do the same thing, check to make sure it's lined with the canthus, which it is, the top of the ear here. I'm going to pull on the penna, which is up here, not the bottom part, sorry. Pull on the penna. Push on the tegus and the mastoid process there. Did you have any pain there?
No.
Okay, and then I'm going to look on the inside of the ear. Okay, just a little bit of earwax there, some serum. Okay, and then next I would do the whisper test, which I would stand behind him, but I'm going to actually stand off here to the side a little bit. And can you just repeat what you hear?
Hamburger.
Okay, and then I'm going to go over to the other side to test the other ear.
Bananas.
Okay, so that means that cranial nerve 8 is intact, which was the whisper test, to check that. The next thing I'm going to do is check your mouth. So the first thing I'm going to look at is, yep, I can check the mouth, that's fine. I'm going to check the mouth here and see or check the nose. I'm actually going to do the nose before the mouth. So the first thing I'm going to look for is if there's any deformity to the outside of the nose at all. Have you ever had any trauma to your nose?
No.
Okay, I'm going to have you push one nostril close and sniff, and then the other side. Okay, and so his nares are patent, and cranial nerve 1 is intact, which would be the smell test. And I'd have him smell. I'm going to look inside your nose if you can lift up. Okay, looks pink, warm, and dry in there. A couple hairs. I don't see any perforation in the nasal septum. I don't see any deformities or anything. So the nose is intact there. I'm going to palpate your frontal sinuses, which are right here. And then your maxillary sinuses. Do you feel any pain with that?
No.
Okay, so now I'm going to move on to the mouth here. And I'm going to look at the lips, and they look pink. There's no lesions, scars, or ulcers or anything. They do look a little bit dry, a little cracking a little bit. But other than that, they look good. I'm going to have you open up your mouth. I'm going to inspect the teeth and the gums at the same time. Okay. He has one tooth missing on the lower left and on the lower right, which are molars. The gums are pink. I don't see any signs of any infection or swelling or edema. Next, I'm going to have you stick out your tongue here, and it is midline. I'm going to have you say ah.
Ah.
Okay, the uvula and the soft plate raised when he did that, which is cranial nerve 10. His gag reflex, can you swallow for me? That's cranial nerve 9. And then I'm going to have you say light, tight, dynamite.
Light, tight, dynamite.
And that means cranial nerve 12 is intact. And I also, let me look one more time. Go ahead and raise tongue out. His hard plate is pink and moist, and he does not have tonsils, so the tonsils are not in place there. So that's everything with the mouth. I'm gonna look here, see his trachea is midline. I'm gonna palpate your thyroid. Okay, any issues with your thyroid?
No.
Okay, that's intact there. The next thing I'm gonna do is I'm going to do your hold on, your cranial nerve 11. I'm gonna have you shrug your shoulders. Okay, which those are symmetric, equal bilateral force. So cranial nerve 11 is intact. Next thing I'm gonna do is your lymph nodes. The first ones are the occipital, which are right back here, which I'm going to show you where they're at. Right here. Okay. I don't feel anything there, no palpitation. Okay, and then I'm going to do the preocular, which are right in front of the ears. Behind the ears are the postocular, nothing. I'm going to do the tonsillar, which are right at the TMJ. Could you open and close your mouth? Okay, TMJ, no cracks or crepitus there, and also the tonsillar. I do not feel any tonsillar lymph nodes there. And the next ones I'm going to check here are the superficial ones. Check them on both sides, sorry. And then the posterior, which are right back here. Subclavicular. Okay, and then I need to check the submental, or mandibular, sorry, submandibular, and the submental are right here under the chin. And then to do the deep veins, I need you to turn your head here, and then I'm going to check on this side. And this is going to hurt a little bit, I'm sorry. Okay, all right, I did not palpate any lymph nodes on any of my examination. Have you ever had problems with swollen lymph nodes?
No.
Never noticed them swollen or anything? Never seen a doctor for that?
No.
Okay. The next thing I'm going to do is I'm going to inspect your JDD, which I'm going to, sitting up here, I don't see any extension of them. The skin on the neck is pink, warm, and dry. Really warm. No issues there. I'm going to have you lay flat so I can check the JDD. Okay. Just going to wait about 30 seconds to assess that. In the meantime, I'm going to palpate your carotid arteries. Okay, his carotid arteries are a 2+. Now looking at the next, I don't see any extension of the JVD vein. Can you sit up for me now? And the next thing I'm going to do is also take your carotid arteries. I'm going to start at the top 1/3, then do midline, and then do lower 1/3, and listen in all 3 spots with the bell side of the stethoscope. Okay. So I'm going to have you breathe in, out, and then hold your breath. No, you got to breathe in, breathe out, and then hold your breath. You can't keep breathing. Out and then stop. Okay, go ahead and breathe. All right, now I'm going to do midline. Okay, go ahead and breathe. Now I'm going to listen to the lower 1/3. Okay, now we're going to do this side. Upper 1/3 first. Okay, breathe. Okay, now we're listening to midline. Go ahead and breathe. Now I'm going to listen to the lower 1/3. Okay, go ahead and breathe. Okay, I didn't hear any abnormal sounds such as bruise or anything, or swishings or any type of noises there. I would say the pulses are a 2+ there for the carotid. The next thing I'm going to do is move on to your lungs. If you want to go ahead and lay down for me. Okay, go ahead and lift your shirt up for me. So the first thing I'm going to do with the chest here is I'm going to inspect the chest. I do notice that he has a freckle here and a scar here. Can you tell me what that scar is from?
Mole.
Mole
Being
removal?
removed.
Okay. I do notice that there's some hair on the chest here. It's normal distribution. His skin is pink, warm, and dry here. I do notice that he is not using his abdominal muscles at all to breathe. His rate looks normal, about 16 a minute, which I checked beforehand. His vitals were done. I don't see any external muscles being used or anything to the such. The next thing I'm going to do is check for crepitus in the chest. I'm going to go ahead and palpate it. No crepitus was present, no crackling there. I'm going to percuss the chest and see if you have anything. It was all Renaissance. I didn't hear any abnormal sounds with that. Next I'm going to also take the lung sounds. I'm going to have you take a deep breath in and out every time I move this stethoscope, okay?
Okay.
Okay, I'm going to start right up at the top here. Okay, I'm going to check the lateral breath sounds when I auscultate on the back. I do want to note now too, do you do home breast examinations?
No.
Okay, you should be doing those monthly to assess for any lumps or anything in the breast or any abnormal lesions or anything. Okay, now I'm going to have you sit up and face that way so I can do your lung sounds on the back side here. Okay, I'm going to have you lift your shirt up. Okay, the first thing I'm going to do is inspect the back. I notice a scar here and scar here. Are those also mole removals?
Yes.
Okay, I do notice a couple freckles here on the back too. The skin is pink, warm, and dry. I notice a tattoo right up here on the upper shoulder. Is there any changes with any of these freckles or moles on your back here?
No.
No change in size, shape, color?
Nope.
Okay. None of the edges seem rigid or none of the colors seem abnormal to be concerned about any of the freckles here. The lung sounds in the back are going to be right here from the nodule C7 down to the bottom of the shoulder blade, which, here, go ahead, sit up. Which is about right here, which that is going to be T8, which is the bottom. And then two more down, two intercostal spaces down is T10, and that's the entire lung field here. And the reason we go down to T10 is during inhalation, the lung field expands and it goes down to T10 here. At T8, I'm going to go ahead and put my thumbs there and pinch some skin together. I'm going to have you, here, let me see if I can get a better picture. Have you take a deep breath in and out. Okay, do it again. Okay, and that was normal. And his AP diameter is 1 to 2 here. Check this way to this way. Okay, it's 1 to 2 here. I've inspected. The next thing I'm going to do is percuss. Okay, then I'm going to palpitate. No crepitus is present so far. Okay, any pain with that?
No.
Okay. Now I'm going to listen to lung field on the back and also listen to the lateral side, lung sounds on the side here, which the lateral, you're going to go from T10 and go over. You'll be at T8 on the side here. Let me do this, like T8, and then you're going to go up 2 intercostal spaces, which will be T6, and that's the lateral lung field there. Okay, go ahead and take a deep breath in. Deeper breaths for me. So I'm at T10, so I'm going to go to the side here. This is T8 and go up 1, 2, that's T6. Same thing over here. T8, T5. Okay, go ahead. Okay, so the lung sounds, posterior and anterior, are clear bilateral. I don't hear any wheezing or abnormal sounds. Do you have any cough or anything recently?
No.
Are you a smoker?
No.
How many pillows do you sleep with at night?
2.
Okay, so you don't have any lung issues whatsoever, no asthma, emphysema, COPD?
No.
Okay, and you don't use oxygen?
No.
Okay. Okay, so you can go ahead and lay back down for me. Oh, you know what? One more thing on the back. I need to do the 99 test. Go ahead and say 99.
99. 99. 99. 99.
Okay, so it was Renaissance with the 99 test there. All right, go ahead and lay down for me. Sorry about that. So the next thing I'm going to do is listen to the heart sounds. If you can go ahead and raise your shirt up for me. The first thing I would do is inspect to make sure I don't see any pulsations or heaves, which I do not see any of those. I'm going to listen to the apical pulse and compare it to the carotid pulse, which is down here at the fifth intercostal space, is the apex of the heart. I'm going to compare them. Okay, and those two are symmetrical. They beat at the same time. The next thing I'm going to do is listen to the lung sounds, S1 and S2, which are the aortic and the pulmotic. Those are in the first intercostal space here on the right and left mid-sternal line. So the first one is aortic. I'm going to go ahead and listen to that right here on the right side of the sternum. Okay, now pulmotic, which is on the left side. Okay, that was S1 and S2 aortic and pulmotic, and I did not hear any bruits, any murmurs or anything, no extra sounds, no S3 or S4. So those are both normal lubbed up sounds. Next I'm going to listen to the Erb's point, which is the third intercostal left sternal border. I'm going to listen to that one below the pulmotic. Okay. Okay, next I'm going to listen to tricuspis, which is the left sternal border, fifth intercostal space. Okay, and now I'm going to listen to the mitral, which is fifth intercostal space, mid-clavicular. Okay, and with those sounds, I did not hear any abnormal sounds, any brewers or murmurs, normal lub-down sounds there. Next, I'm going to move down to the abdomen. The first thing I'm going to do is inspect it for any masses, bulges, lesions, anything there, any pulsations, which I do not see any of those. I see some hair, which is got normal distribution around the umbilicus, which is midline. And then I'm going to test the skin, which is pink, warm, and dry. A little cool, actually. And then normal distribution of the hair, no masses. Do you have any issues with your abdomen? Do you have any organ issue, diverticulitis, irritable bowel syndrome, pancreatitis, anything to the following?
No.
Okay, and are your kidneys okay?
Yes.
Okay. Do you have any problems urinating?
No.
Have you ever seen any mucus or blood in your urine?
No.
Do you have any problems with incontinence of urine?
No.
Do you have any retention, like difficulty urinating?
No.
Okay, and what color is your urine?
Clear with a little bit of yellow.
Okay, all right. And then with your bowels, do you have a normal bowel movement?
Yes.
When was your last bowel movement?
This morning.
Okay, and what color is your bowel movement?
Brown.
Okay, and have you ever had any incontinence of bowel?
No.
Have you ever been constipated and had to take anything for that?
No.
Okay, and have you ever seen any mucus or blood or anything?
No.
Do you have a history of hemorrhoids?
No.
Okay, And then with your period area, do you have any lesions, any abnormal distribution of hair, any burning, anything?
No.
Okay. After inspecting the abdomen, I'm going to also take the bowel sounds and listen for those. I'm going to start in the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Okay, his bowel sounds are definitely active. Next, I'm going to listen to the arteries in the abdomen. I'm going to listen to the renal and the iliac arteries. How I'm going to do this is, I don't know if I can see me. I'm going to go ahead and do the V upwards, and then I'm going to do the V downwards. The V upward is going to be my renal arteries, and then I'm going to listen to the aortic, which is going to be just left of the midline there. Okay, first I'm going to listen to the aortic, just left of the midline. Okay, now I'm going to do the V and listen to the renal. And then I'm going to listen to the iliac. Okay, I didn't hear any bruits or any abnormal sounds there with the renal or the iliac arteries or in the aortic. I also listened to the aortic there. The next thing I'm going to do is percuss the stomach. Okay, it was dull in the right upper quadrant due to the liver. Other than that, it was renaissance throughout. The next thing I'm going to do is do a light oh shit. Okay, shoot, it said low battery. The next thing I'm going to do is do a light palpitation to the abdomen area. And you said you have no current pain, correct? No. Okay, light palpitation. Okay, when I palpated the stomach lightly, I didn't see any change to his facial expression or any guarding whatsoever, and he did not flinch at all. Now I'm going to do deep palpitation. Any pain with deep palpitation?
No.
Okay, and once again, he didn't have any grimace face or anything, no guarding or no clenching when I did that, so the abdomen is all clear there. So I can have you go ahead and pull down your shirt there. Now I'm going to do all four extremities here. We're going to start with the upper extremities. The first thing I'm going to do is range of motion. I'm going to start with the shoulder. We're going to do flexion, extension, abduction, adduction. Okay, now we're going to do the elbow, flexion, extension, adduction, abduction. Then we're going to do the wrist, flexion, extension, abduction, adduction. And then we're going to do the fingers. We're going to flex the fingers. And we're going to extend them. Okay. Okay, and then I'm going to check the nails here for the capillary refill. Alright, it was all less than 3 seconds. And the nails, they're well groomed. The thickness and color is normal. I'm going to inspect the arm. I do notice 2 tattoos here on the upper right arm, and then some freckles throughout. Has there been any changes with these freckles at all?
No.
Okay, I'm going to do supination and pronation with the arm here. Can you do that on your own? Okay, which the patient was able to do that. I'm going to check for edema and a bony prominence, which is on the radial bone here. No presence of edema. And then, I did the capillary refill. I need to check your pulses. Can I see that arm to do your radial pulses? radial pulses are equal bilateral 2+. And then I'm going to check the brachial arteries, or pulses, not arteries. I feel like my ass is right in this thing. Those are equal bilateral 2+. Now I'm going to do the, what do you call that? The range of motion on the left arm here. Okay, so I'm going to do the shoulder first. Flexion, extension, abduction, adduction. Same thing with the elbow. Flexion, extension, adduction, abduction. Same thing with the wrist. Flexion, extension, adduction, abduction. And then with the fingers, we're going to do flexion or extension, flexion, adduction, abduction. Check capillary refill on all of them. I'm going to have you turn your hand over and then turn it back over. That's supination, pronation. The fingernails, I've inspected them and they look, the thickness is appropriate and the color, and they're well groomed. The other thing I'm going to have you do is I'm going to put my finger right here and I'm going to have you take your finger and touch my finger and then your nose. Keep doing it. Okay, his coordination is correct there. All right. Oh, and let me hold on. Inspect the arm here. There's a tattoo on his upper bicep, lower forearm, inside of the forearm. I noticed a couple freckles. Any changes there?
Nope.
Skin is pink, warm, and dry. I checked the brachial and the radial. Let me check your edema. No edema. Okay. Everything's good there. Okay, let me come back around. Okay, so that was the upper extremities of the supination, pronation, the finger coordination. Okay, go ahead and uncross your legs for me. The femoral arteries are right up here in the groin area where I would check those. Popliteal is on the back of the knee. If you could bring your pant legs up so I can check your popliteal pulses there. Yeah, that works better. If you can pull these up for me. Check the popliteal. These are the worst ones ever. Here, just relax your knees right down, yeah. I'll bring them up a little bit. Okay, the popliteal pulses are present. They're about a 1+. I'm going to check the dorsal pallus. No, that's the top of the foot. This is the posterior tibia. Stop laughing at me. I'm checking them on the inside of the foot here at the lower part. Those are equal bilateral as well, and they are 2+. Now I'm going to check the dorsalis pedis, which is the top of the foot here. Oh, it's not seeing me do it. There we go. Those are equal bilateral, I'd say a 2+. Okay, next thing I'm going to do is inspect the toes. I'm going to do cap refill first, which is less than 3 seconds on both feet. The nails are appropriate thickness and color, and they are well groomed. Just the X back on here, sir.
Thanks.
Yep. There you go, patient Smith. Okay, and then I'm going to inspect the legs. There is normal, let me turn it, normal distribution of hair. The skin is pink, warm, and dry. I'm going to check for edema or bony prominence there, which is not present. He does have hair, but it is normal distribution here. I'm going to check range of motion now in your lower extremities. So, can I see? I'm going to check the hip, abduction, adduction here. Same thing on this side. Check the hip, flexion, extension, adduction, abduction. Go ahead and with the knee. Okay, and the other knee. And then the wrist or the ankle here with flexion, extension, abduction, adduction. Same thing here, flexion, abduction, adduction. Could you sit straight so the camera can see you better? Sorry, it's not doing too well. And then with the toes, I'm going to do flexion, extension, flexion, extension. I'm going to have you grip both my hands here, squeeze, equal force bilaterally. Now I'm going to have you push against my hands and now pull. Okay, equal force there with the feet. I'll check how the pulse is there. I'm going to have you take your right foot and run it down your left shin if you could. And then same thing with the other side. Do you have any neuropathy or pain in your feet?
No.
Okay, I'm going to do a test on the bottom of your feet here. Tell me if you can feel it. Where's my pen? Okay, if you can feel the... Can you, let me see. Can you feel that?
Yep.
Okay, and then we're going to do this side. I'm just doing a sharp, well, I'll tell you afterwards what I'm doing so the patient doesn't know. Go ahead. Can you feel that? Okay. I did a sharp sensation on the bottom of the feet to check for neuropathy or any parathis. And then I'm going to do the reflux, which should not be present in an adult. So I'm going to have you put your foot straight up. I'm going to rub right here. And normally in a baby, the big toe will go up while the rest of the toes go down. So I just need to assess your, keep your... And that did not occur, which is a good sign. So I checked that reflex there. I already said your posture was right, your ambulation, checked your grips. All right, I think that is the end of my assessment. Do you have any questions?
Nope.
All right, thank you.